Hey, it's Dan Heckman here again, back and ready to talk about neoplasia, which is the second very important section of the pathology section. And once again, this is just going to be a breakdown and a foundation for the rest of the book, where you'll learn in more detail about neoplasia with each specific system. But in this section, we're just going to go over the basics, and there will be some unfortunate rote laundry list information sections, but I'll try to make it fun with some mnemonics and other ways to help you remember things. So pay attention, and once again, it's going to be very interactive, so get ready to answer some questions, and I think it'll be a lot of fun for you. So let's get started. So we're going to start off by talking about how cancers form. Cancer, of course, another word for neoplasia. Neoplastic progression. How does it start from healthy tissue and turn into cancer? How does that happen? So we'll start off by saying what the normal is. So let's say a normal epithelium. And we'll talk about skin because I'm going into the derm. So a little biased here. So let's say we have skin tissue. What comprises a normal epithelium? So we have on the ground floor, the lowest layer there is, what's that called? The basal layer with basal cells, all the stem cells that divide. And after these cells divide, they tend to mature, especially in the skin, and flatten out. As we see towards the top of the skin, there's the more apical, specialized cells towards the surface. The cells mature as they go towards the surface and eventually are shed, and the whole process starts over again. So what's underneath this? Well, we talked about it before. There's type 4 collagen in this layer. What is it? Type 4 on the floor is the basement membrane. Very good. And underneath the basement membrane, we have like arteries and nerves and other connective tissue. So that is a normal epithelium. And this is really important because we're going to talk about this a lot in the progression of cancer from healthy tissue to cancerous tissue. Good. So we know the normal. Now let's talk about the abnormal. But before we get into that, let's quick talk about how cancer cells, just very briefly, how they adapt to and resist medications. So there's a special protein called P-glycoprotein, where here's a cancerous cell. And sometimes when you give this cell chemotherapy to try to kill it, to complex with the DNA and stop proliferation and kill the cell, sometimes these cancer cells actually develop this channel that actually pumps out the medications. Wow, pretty neat, right? Let's see that again. Boom. And that is called MDR1. And it stands for multi-drug resistant protein 1. Okay, now we talked about that brief little tidbit. Let's get into the gritty details of neoplastic progression. All right, so now let's resume talking about the journey that normal cells go through when they're turning into cancer cells, or another word is neoplastic cells. So speaking of neoplastic, the word plasia is going to be involved in each of the stages that these cells go through when they're turning from normal into neoplastic. So neoplastic, again, means neo means new, and plasia means growth. So new growth, that's another word for cancer. And a thing to keep in mind actually is when these cells are transforming into cancerous cells, they just become more and more lost in their identity. They forget who they really are. So you can think of them becoming more and more schizophrenic, essentially. So that's just a helpful little analogy to keep in mind. So let's do this. Let's talk about the different stages by playing a fun little game. So I'm going to visually describe what's going on, and you're going to tell me what type of plasia is taking place. Got it? Good. So let's talk about the reversible changes that take place first. So when cells increase in number, just increase in number, what's that called? Hyperplasia, right? Hyper means increased growth. Hyperplasia. That's an easy one. Good job. What about when, the cells are really starting to become lost? They're losing respect to their orientation, their size, their shape. What's that called? They're abnormally growing, becoming confused. I mean, the cells on top aren't supposed to look like the cells on bottom. They're supposed to be more differentiated, right? So these confused cells are called what? What type of growth is this? Dysplasia, abnormal growth. And another type of abnormal growth that's still reversible is, well, let's go through an example. So what's the lining of your main stem bronchus? It's columnar, pseudostratified, ciliated, right? Right. Okay. So when someone smokes, all this smoke irritant is going to really sort of tick off these cells, and they're going to say, hey, I don't want to be exposed to this smoke. I'm going to try to protect myself more. I'm going to change from this columnar type into a more protective type of cell that is, can you guess? Squamous. Squamous stratified epithelium. So all these cells are more protective, and the smoke irritant can bounce off of these barricaded cells. So that's good in one sense that they changed and are more protective, but that's bad in another sense because guess what? They had to alter their DNA to change into these cells. And anytime you alter your DNA, you're running the risk of mutations and neoplastic progression. So that's actually bad overall. But what is this called? What is this metamorphosis called? This transformation from one adult cell type into another? That is called metaplasia. Very good. Now we're going to talk about some of the bad changes, the really bad ones, the irreversible changes. So, what happens when cells look like this? They are really lost. They look nothing like their primitive tissue. They have a very high nuclear to cytoplasmic ratio because all they care about is just dividing and making more and more copies of themselves. So what is that called? Anaplasia. Anaplasia. Ana means without, and plasia means growth. So that's without normal growth. It's essentially cancer on site. That's another name for it, is carcinoma in situ. And then if they keep progressing and have just continued uncontrollable proliferation and making clonal copies of themselves, that is full-blown neoplasia. We have reached the end of the line. They are cancer. Bad news bears. All right. So let's talk about some other changes that can take place. What about when fibrous tissue develops that's associated with these neoplastic cells? What's that called? Well, another word for fiber or fibrous is desmo. Think of like desmogliin and desmosomes as fibrous things attaching to each other. So that's called desmoplasia. And how does this actually develop? Well, the way that I think is there's probably a lot of inhibitory cytokines being released, right, to try to tell these cells to stop growing. Well, what's one of the major inhibitory cytokines? TGF-beta, transforming growth factor beta. And in addition to inhibiting cells, what does this also do? This can stimulate fibroblasts to make what? Collagen. So that's my theory why there's this associated fibrous tissue, is because the fibroblasts are stimulated by this inhibitory growth factor. Anyway, that's just, I like to ask why and try to come up with explanations myself whenever I was studying. I definitely and highly encourage you to do the same thing. It helps material become more personal and stick to you better. You'll do much better on the tests and become a much better doctor as a result. So that's not too bad, is it? So, all right, good. So let's talk about some more. Sometimes these cancerous cells start to evolve enzymes that can tear up tissue and tear up the basement membrane in endothelial cells. By the way, what type of collagen is in the basement membrane? Type 4. So they must have type 4 collagenases that can tear through. And then this creates a passageway now for these neoplastic cells to sort of army crawl their way through and spread. What happens when they spread? What's that called? Metastasis. Very good, but not very good for whoever this is taking place in, because that means the cells are going to end up in other tissues and worsen the prognosis. And when these cells reach other tissues, they're going to need to make new vasculature. What's that called? Or what's a cytokine that is involved in that? They're going to need to release VEGF, FGF that we talked about before to stimulate neovascularization and give themselves new blood supply wherever they end up. So those are the main types of plasias and the main progression from normal epithelium to cancer. Pretty cool, right? And you figured it out on your own. You got all of them right, I hope. Let's now talk about grade versus stage. So essentially, grade is just what does the tumor look like? What is its appearance? And you can think of this on a scale of 1 to 4. So here's the normal tissue. How closely does the cancerous cell resemble the normal tissue? If it resembles it almost identically, is that a high or a low grade? That's a low grade. That would be like 1. Remember, the scale is from 1 to 4. So what if the neoplastic tissue is very dysplastic and does not resemble the normal tissue very much at all? Like we saw here with these anaplastic cells. Very high nuclear to cytoplasmic ratio and very abnormal and primitive appearing. Is this a high or a low grade? It would be a high grade, probably grade 4. Good. So that's essentially what grade is. How differentiated is the cancer? Is it well differentiated, or where it appears like the normal tissue, or is it not differentiated and primitive looking, high nuclear to cytoplasmic ratio, like we see here, and has a very high grade? Let's next talk about stage, and stage is very important because this determines the prognosis. So that's why patients care about stage, and that's why you should care about stage too, more so than grade. Grade is for pathologists. Stage is for patients in medical treatment. So we use the TNM staging system to stage cancers. And essentially, each of these letters stands for something different. And the more letters that are involved, the higher the stage and the worse the prognosis. So T essentially stands for tumor. How big is the tumor? And it's just embedded in tissue. So how big is the tumor in the tissue? That is the T, the extent of the T. If it's a big tumor, it's going to be a higher number for T. All right. N is for nodes, lymph nodes. So how many lymph nodes has this cancer spread to? Okay. And the more nodes, the higher the number for N, the worse the prognosis. And M is for, you guessed it, metastasis outside of lymph nodes. And this is always stage 4. Again, this is from 1 to 4. And if M is present at all, if there's any metastasis outside of lymph nodes, that is stage 4. Metastatic cancer, the worst prognosis. So here we see it going to the brain. Flash quiz. Ooh. So very easy question. What are the 2 main types of neoplasia? Benign and malignant.